Hi, everyone. We're going to get started in just a moment. We're going to give people just another minute to sign on. Okay, I lied. We gave people about 30 seconds to sign on, but they'll catch up. So welcome everyone to today's webinar, Cannabis for Medical Disorders. I'm Christine Benjamin, the Senior Director of Patient Support and Education at SHARE. And before the presentation begins, I would like to tell you just a little bit about SHARE. SHARE is a nonprofit organization that has been helping people through breast, ovarian, and uterine cancer for the last 44 years by offering the support of those who have been there. SHARE provides many services, including a helpline, support groups, and educational programs. All services are free of charge to participants. For more information, please visit our website at sharecancersupport.org. So all participants will be muted during the presentation. When Dr. Martinez is finished presenting, we will begin the Q&A discussion. You are welcome to submit questions during the presentation through the question pane in the control panel on your screen. When asking questions, remember that the presenter is unable to give specific medical advice, so please keep your questions general in nature. This webinar is being recorded and will be available on the SHARE website soon. Now I'd like to introduce our speaker. Dr. Diana Martinez is a psychiatrist and researcher at Columbia University. Her studies focus on developing new treatments for medical problems that are difficult to treat, including pain. This includes research on neuropathic pain using medical marijuana and brain stimulation techniques. Welcome, Dr. Martinez. Thank you so much for being here. I'll turn it over to you now.
Absolutely. Thank you for having me. So today I'll be talking about marijuana and chemotherapy-induced peripheral neuropathy. And just as a disclaimer, I'll be saying cannabis instead of marijuana, since that's my habit. In research, we usually use the term cannabis. So please keep that in mind as we move forward. I've left plenty of time for questions, I believe, at the end, and I will be happy to take any questions. If for any reason I don't get to something, or if you think of something later down the road, you can always look me up. If you put in Diana Martinez Columbia, it'll pull up my website, and it has my phone number and my email. I am much better with email than I am with phone. Please keep that in mind. Sometimes I get a little bit behind, but I will try to get to any questions that come up later. Okay, so we're going to start with a little bit of history of cannabis. So cannabis has been used for many, many centuries as both a medicine and an intoxicant. It was described in the Vedas, which is an ancient Hindu script, as a gift from Shiva. The medical use of cannabis really developed in the 1800s. A physician named William O'Shaughnessy was hired by the British India Company and went to India where he where he started studying cannabis for pain, spasticity, and seizures. He wrote on about his work, and especially with seizures, he found some real luck in treating children with seizures using cannabis. He returned to London and started making cannabis available as a medication. And in 1890, Sir Russell Reynolds, who was actually the physician for Queen Victoria's family, recommended using cannabis for pain instead of morphine. And it turns out that in the late 1800s, morphine dependence was a huge epidemic in Victorian England and in the United States as well. In the United States, cannabis was used a little less frequently than it was in England and in Europe. It was used sort of mostly as a medication, a bit as an intoxicant in the late 1800s, early 1900s, until it was restricted by the Marijuana Tax Act in 1937 and then outlawed in the 1950s. In 1970, Richard Nixon signed the Controlled Substance Act, and that's what really put different medications and different drugs into categories. Cannabis was placed as a Schedule I drug, which means it has a high potential for abuse and no accepted medical use. To put this in perspective, drugs like Percocet or OxyContin are Schedule II, which means that they can be prescribed by physicians, although one has to be careful of addiction. Schedule I drugs cannot be prescribed by a physician for any reason. And Schedule I drugs include cannabis, heroin, PCP, MDMA, and other drugs like that. So since 1972, there have been multiple petitions submitted to the DEA in an attempt to move cannabis off of Schedule 1 onto at least Schedule 2 so that it can be prescribed by physicians. However, that has not yet happened to date. As a result, the laws have been changing on a statewide level. On a national level, on a federal level, cannabis is flat out illegal, with the exception of hemp, which we will get to. So as I mentioned, cannabis is the same thing in my mind as marijuana and hemp. All of these are really the same plant. However, these days we're using hemp to describe the plant that has less than 0.3% of THC. This is often used to make CBD. So this is marijuana plant with very low levels of THC that has CBD in it that we now refer to as hemp. As a result, we now have things like cannabis, marijuana, and hemp. And different states vary as to what's allowed and what's not allowed. And I have to tell you, so this slide is from, or this is from August 2019. I think there have been more changes. It's very hard to keep up. Some states have medical and recreational marijuana or cannabis legalized. Some have medical only. Some have decriminalized cannabis. And some have CBD programs. So there's a lot of variability, and you would really have to check by your home state. I can tell you in New York, we have medical marijuana available. Recreational marijuana has not yet been approved. That may be happening, but will mostly be what I'll be talking about today is the use of cannabis for medical disorders and things that people need to be careful of and to know about. So the two cannabinoids that are mostly studied and the ones I'll be talking about are THC, which is short for delta-9 tetrahydrocannabinol. This is the compound in cannabis that causes high euphoria appetite stimulation. I'll also be talking about CBD, which is cannabidiol. It doesn't create a high. At high doses, at large doses, it can have sedation, but for the most part, CBD doesn't really have any sort of psychoactive or notable effects. So again, by federal law, any cannabis that has THC is illegal. Some have legalized it. On a nationwide basis, hemp is now largely considered legal, and this is what's often used to make CBD products. Now what? Sorry about that. So these are the approved conditions for medical cannabis across all the 50 states. And as you can see, it's quite a long list. There are 51 indications across different states. So different states, for example, have different criteria. So in New York State, PTSD is a qualifying disease, is a qualifying factor in order to receive medical marijuana, but not, for example, in other states. In some states, glaucoma is a qualifying factor, but not in New York State. So this is really not based on science, it's more based on lawmakers. And this is quite problematic from a scientific perspective because the honest truth is that we really don't have data on most of these disorders. And this goes back to the fact that because cannabis is Schedule 1, it makes research with these products very difficult. There are many layers of approval that need to be obtained, and many researchers can't obtain all of these approvals. So this is what has set us back significantly in studying the effects of cannabis as a medication. In 2017, the National Academies of Sciences, Engineering, and Medicine released a report on medical cannabis. The report is quite exhaustive. You can buy it online. It's a many page book. You can also, though, look at the synopsis if you choose to, and I highly recommend it. It's a very reliable source. It's done by many researchers. There's a short PowerPoint presentation, and there's also shortened versions of the report if you would like to take a look at it. It was last done in 2017, and I can say for the most part, there have been a few more advances with respect to cannabis as a medication, but not really many. So I still say that this stands as like the most reliable source when it comes to medical cannabis. So according to the report, the strongest support for the medical uses of THC include, first and foremost, pain. So THC reduces pain. It's estimated that about 10 milligrams of THC is about equivalent to 60 milligrams of codeine. The second indication is spasticity or muscle stiffness. This has been studied specifically in multiple sclerosis, and THC has been shown to improve spasticity in multiple sclerosis specifically. Now, there are two FDA-approved drugs that contain THC. These are called dronabinol and nabilone. So dronabinol is actually THC in pill form. Nabilone is similar. It's a congener. It's a much higher potency, but they're very similar drugs. And these drugs are FDA approved, and they're approved for nausea and vomiting caused by chemotherapy and appetite stimulation in AIDS. The report also reviewed some of the moderate findings, moderate support for THC, and the most consistent moderate support was that THC improved sleep outcomes in patients with obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. As you can see, most of these studies have been done in multiple sclerosis. Now let's talk about CBD. So those were the previous slide. This is the medical uses of THC, and these are the medical uses of CBD. So hands down, the strongest support for CBD is that of epilepsy. There was a large study done recently. It's in childhood epilepsy caused by Dravet and Lennox-Gastaut syndrome. High doses of CBD reduced seizures by 50%. And this study was done specifically in patients who had uncontrollable seizures. Other than that, we really have a lack of research when it comes to the medical uses of CBD. There is some evidence that shows that high doses of CBD can help with psychosis and schizophrenia. And there's a small amount of data suggesting that CBD may be helpful for social anxiety disorder. It's really one small study and it needs to be replicated. So for the most part, even though CBD is marketed to improve pain, depression, anxiety, sleep, cancer, and many other things, these indications are simply not tested. My apologies. Okay, so you may have heard a lot about THC, CBD, and cancer. And it is true that there are many studies in rodents showing that THC and or CBD reduce tumor growth in animal models of breast, lung, liver, and prostate cancer. However, we do not know if this works in humans. It's not known at this point if THC or CBD have any effect when it comes to reducing tumor growth or tumor burden in humans. The research simply hasn't been done. There was one report of CBD and GBM. Actually, it was cannabis and GBM. This is a product called Sativex, which has come out of London. It's a company in England called GW Pharma. And they reported that patients who had a brain tumor, glioblastoma, lived longer if they were treated with CBD and THC compared to those who didn't. However, the company releases as a press release and has never submitted the data to a medical journal where it could be reviewed by independent researchers. And so I would have to say this really remains an unknown until that happens. So now, even though we have limited indications for THC and CBD, many people still want to take them. And so let's talk about the sources of THC and CBD. So just as a reminder, THC causes high, CBD does not, although it can have some sedation. So there are four major sources of THC and CBD. The first is just cannabis plant, the stuff that comes in a bag from friends, family, or dealers. I would say most people who get a cancer diagnosis usually get an offer of cannabis plant from someone. What I will say about the cannabis plant is that the THC concentration varies a lot. There's no way to know how much is in there. It can go from very high to very low. And when you cannabis plant purchased from whoever usually has little to no CBD. Cannabis plant that's available on the street, for example, has been bred to have high concentrations of THC, and usually there's little CBD. The next source of THC is the synthetic cannabinoids. Again, these are the FDA-approved drugs. These include dronabinol and nabilone. And as I mentioned, they're approved for HIV patients and chemotherapy-induced nausea and vomiting. I'm really going to focus on sources 3 and 4 throughout the rest of this talk. So source 3 is cannabis plant extract. This is usually what comes from medical marijuana dispensaries. It has a known amount of THC and CBD. The concentrations are tested and consistent, and it requires certification from a doctor and a medical marijuana card if you're in New York State. That's the case with most states that have medical marijuana. And then the fourth source is CBD products. These are products purchased online or in stores. Again, they're low THC, but they're largely unregulated, and it's really hard to know what's being sold. And we'll discuss this more. This is something to be very careful of. Oh, my apologies. This is a repeat slide. I'm going to move forward. So now let's talk about the risks of THC. So these are the risks that come with a medically ill patient using THC. Actually, I guess with anyone, but I'm going to focus on medically ill patients. So if you're taking THC, whether it's in plant form or even if it's in pill form or any form, the most common side effects are dizziness, intoxication, drowsiness, anxiety, and paranoia. It's easy to take too much THC, and taking too much THC can really make someone quite uncomfortable and quite paranoid. And so, and the only treatment for that is actually time. Certainly driving is a contraindicated. Anything that takes coordination is a problem. There's definitely a risk of falls with the use of THC in medically ill patients. And there is actually a risk of chest pain, arrhythmia, CV8 cardiovascular event, or a heart attack with cannabis use. This is mostly seen with smoking, but there is an increase in heart attack and the death rate among heart attack survivors with the use of smoking cannabis. It's not been shown with oral cannabis, but it's still something to be very wary of if one has an underlying history of heart disease. There also is a potential of interaction between THC and medications. Mostly this would include warfarin, Plavix, or some of the anti-epileptics, some antibiotics, and some antifungals. These indications, these interactions are mostly theoretical. We haven't seen people have problems with bleeding, for example, if they're taking Coumadin or warfarin. But if that is a medication that someone is taking, you need to be very careful. And then, of course, unintentional overdose in children and pets is a significant risk when it comes to THC. Now I'll talk about the risks of CBD. So in high doses, CBD can cause sleepiness and diarrhea and can interact with medications. This was mostly data from the epilepsy study that I mentioned previously, and these were very high doses of CBD. Nonetheless, like THC, if one is taking medications like warfarin, which is Coumadin, Plavix, or antiepileptics, it's worth being very careful and thinking about drug interactions. I would say, though, that the biggest risk factor when taking CBD is that most products that are sold as CBD are not indeed CBD. The only FDA-approved CBD drug is Epidiolex. This is a prescription and is really only available for childhood seizures. Every other source of CBD is really unregulated, at least on a federal level. So if you're buying CBD at a health food store or online, you need to be very careful and make sure that you know what's in there. Even though it's expensive, there's no guarantee necessarily that CBD is in the product. I'll also add that vaping CBD products is very dangerous. I would never recommend that under any case. You may remember EVALI. We were all talking about it last fall before COVID. EVALI is mostly seen in patients who were vaping nicotine products or e-cigarettes, but there have been reports of EVALI in patients who are using THC vape products, and 17% of patients who are vaping CBD 17% of EVALI patients were vaping CBD. So it's very important, in my mind, to certainly not inhale any unregulated product. So let's talk about the reliable sources of CBD. So if one wants to take CBD and see if it's helpful for them, I would say the most reliable dose is Epidiolex. Again, this is the FDA-approved drug for seizures. However, it requires a prescription. It's quite expensive. It's not covered by insurance if you don't have a childhood seizure disorder, and it's still pretty hard to find. Next would be the state dispensary. So if you qualify for medical marijuana and you get a certification, you can go to a state dispensary and they will sell you product that has CBD. It's regulated by the state, not the FDA, but in general, it's safe. And the amount of drug or amount of CBD that's listed in the product is usually verified. And it is a product that has been tested. As far as I know, it's not covered by insurance. I don't know that it will be. And so one of the downsides of obtaining CBD from a state dispensary is the fact that it's expensive. And then there's online and in-person stores. In this case, I would just say it's worthy of being wary. So this is data here from the FDA website. So the FDA has sent out warning letters to many companies who are selling CBD products. every now and then they test some of these products, and they show that indeed they contain usually no CBD. We're talking about 0.0024% CBD in these various different products. There's one, Michigan Herbal Remedies, another one called Morgue Juice. Not sure who would sell or buy that. Then there's Pain Balm. And again, every now and then the FDA does test these, and they send cease and desist letters to them because they're marketing a product that they don't contain the product that they say, and they also make claims that can't be substantiated. So when I have talked to family, I've talked to patients and family members, people who still want to take CBD, what I say is that your best bet is to ask for a certificate of analysis before purchasing any CBD product, either in a store or online. So this is what a certificate of analysis looks like. This is one here that I just downloaded and took a screenshot of. Some stores that are online will provide them. Oftentimes they will not. And so if you're going to be looking online for CBD, I would say look at companies that will provide a certificate of analysis or a COA. There have been some websites that offer certification programs. One's called US Hemp Authority. You can go onto their website. It's run by CBD companies, and it has a certification process. However, when I've looked at their certification process, I don't see a single COA, and I would require a COA. Oh, my apologies. Before buying a product. It's important that the COA be done by an independent laboratory, not by the company selling CBD itself. It should include the levels of different cannabinoids. And in my example here, you can see that they tested for delta 9 THC, CBD, delta 8 THC. There are many, many cannabinoids, and they should be testing for at least delta 9 THC and delta 8 THC, because delta 8 THC can also have some high, like delta 9 THC. So you may be taking CBD, you think it's going to have no effect on your perception or your ability to function, and that's not necessarily true. I have seen patients who took CBD that they bought online and unfortunately took it when they were needed to do something, and they felt very sedated and fairly intoxicated. And even though that product had no delta 9 THC, it might have had delta 8 THC. So it's important to look at these things. You should also look at things like microbial contaminants. These are things like yeast, molds, and bacteria. Salmonella and E. coli need to be tested for because those can be in products that are purchased. And it should also look for heavy metals like arsenic, lead, and mercury. Now, I'd like to add that most CBD retailers often don't provide the COA prior to purchase. Some of them will provide it after purchase. So some of them, once you buy the CBD product, there's a lot number, and you can go back online and you can search for the lot number and you can see the COA. Very few of them show it to you ahead of time. I'm not thrilled about that, but at least it's a step above providing no certificate of analysis at all. In general, I'll say many of the companies from Colorado are more likely to have a COA. I think other states may as well, but Colorado does require a COA. Not all companies post it, but they usually need to do it. So again, I'll just review carefully sources of cannabinoid and safety. Unauthorized sources, this is cannabis plant from friends and family. The pro of this is that it's easy to find. The con is that it usually has no CBD. The concentration of THC is unknown. And what's concerning to me, at least as a physician, is that the fact that cannabis plant can have contaminants like molds, mold, bacteria, and heavy metals and pesticides. And I would say cannabis plant that is smoked, to me, would be the most worrisome way of taking cannabis. Second, we have medical marijuana from state dispensaries. The pro is that this product is tested for contaminants, although I will say the degree of testing varies by state to state. In New York State, there's pretty rigorous testing. The concentration of THC and CBD are accurately labeled if you go to a medical marijuana dispensary. The con is that you must have a qualifying disorder in order to be eligible, and that it tends to be expensive. And then item 3, we have CBD retailers, online or in stores. Again, it's easy to find. The con is that there's little regulation. You can't always trust the label. Just because you buy a bottle of CBD in a health food store, you really can't trust what it says on the label. It really needs to have a company that has a COA. that's done by an independent lab. And it needs to test, again, not only for cannabinoids, but also contaminants, which is very important in medically ill patients. That includes mold, bacteria, pesticides, and heavy metals. And now I would just like to talk to you briefly about the research that we're doing in my lab. We're very excited to do this study. We're looking at cannabis and taxane-induced peripheral neuropathy. I'm excited to do this study because, as I mentioned, the primary data that supports the use of cannabis as a medication is that for pain. Cannabis has been tested for pain in HIV-induced neuropathy and also diabetic neuropathy. Here I have data showing just these are ratings of pain for placebo versus cannabis, and it's showing that patients see an improvement in their pain when they use cannabis product. One of these studies was done with smoked cannabis. Actually, both these studies were done with smoked cannabis, and in both cases, the effect on pain was very immediate, but patients also had a lot of cognitive effects from cannabis, which oftentimes medical patients don't really appreciate or don't want to have the cognitive effects of being high, basically. So we're trying to look at this another way. We're doing a study with THC and CBD. Our study right now is specifically in neuropathy caused by paclitaxel or docetaxel in breast cancer patients. Down the road, we're going to try to open it to other types of cancers, but we're focusing on paclitaxel-induced neuropathy. And this is because rodent studies have previously shown that THC and CBD are helpful with neuropathy caused by paclitaxel. And so we're interested in moving that study from rodent to human. I'll just say once again, our study is in breast cancer. We call it the PINK study. We do provide transportation door to door. We use medication that's provided by Tilray, which is a Canadian medical cannabis company. So we are using pharmaceutical grade cannabis. Let me say, just please, if you feel like it, you could spread the word about our study. We'd greatly appreciate it. Nonetheless, if you have more questions for me and you don't want to be in the study or don't qualify for the study, I still welcome you to reach out and ask me any questions that you may have about the things we talked about today. My lab phone numbers are here. My email address is here. As I mentioned, I'm much better with email than I am with voicemail in my office. And if for some reason you can't remember, you can look up Pink Columbia or Diana Martinez Columbia, and it will have my contact information there. And as I've mentioned, I'm happy to answer any questions.
Thank you, Dr. Martinez. That was really very, very interesting. So I just want to let people know to type in your questions in the question pane, and I will read them to Dr. Martinez. So one question is about the PINK study. Is it open to all breast cancer types and stages?
Yes, it's specifically looking at painful neuropathy, and so that's what we're interested in targeting. Painful neuropathy caused by paclitaxel in breast cancer. If the neuropathy has been lasting for years since chemo, which often happens, that's one of the reasons why we're so interested in this topic, is that oftentimes the neuropathy caused by Taxol lasts for years. And so there's no cutoff in terms of like how long you've had neuropathy.
And so how do you measure whether or not it's working?
Our study is really looking at pain, and we just ask people, it's really simple, on a scale of 1 to 10, how much pain are you feeling? We are interested in measures besides pain, and so we are doing some other tactile tasks where we ask you to feel different things, and we're trying to see if the ability to perceive touch improves, but our main outcome measure is just simply asking people if it makes them feel any better.
So someone is asking, is it good for metastatic breast cancer stage 4? The answer is yes, right?
Yes, if it's stage 4, if you're on active chemo, we can't enroll you in the study. The FDA did not give us approval. But if you're on like immunotherapy, you're eligible. But if you're on active cytotoxic chemo, you're not. I would recommend give me a call, send me an email, and we'll sort it out. And even if you're not eligible for the study, I will discuss any options with you when it comes to neuropathy.
Okay, and Jody is asking, do you think that the cannabis might be effective in neuropathy that is numb but not painful?
We actually do. Primarily we wanted to look at numbness itself rather than pain. What's interesting is the way that Taxol works is that it stabilizes microtubules. Microtubules are basically the scaffolding of cells. So it's sort of like, it's the studs in a wall. It strengthens the studs in a wall. And that's what prevents cells from dividing. However, that has an effect on the nerve endings in the fingers and toes, and it makes them very brittle and stiff, and they break, and that's what causes neuropathy with Taxol. In the animal studies, CBD and THC both helped prevent that from happening. So we are actually interested in looking at non-painful neuropathy. However, we're going to have to do that down the road. With our first study, we had to stick with painful neuropathy just because of the previous data showing that pain is efficacious. But that's why our primary outcome measure is pain, but we're also looking at other measures of neuropathy. And ideally, I'll just add, in an ideal world, I would actually try and pre-treat of patients with cancer with THC and CBD and see if we could prevent neuropathy even from happening, but we're not at that point yet with the research. And there's, that's been shown in rodent studies, but we just don't have enough safety data to try that in humans at this point.
And someone is asking about, is there any, you may have answered this already, but what research is out there about using cannabis to actually treat breast cancer, not just helping with the side effects?
So the only research that has been done looking at cannabinoids, cannabis in general, for breast cancer, or looking at tumor growth itself, is all in rodents. And there are some promising studies showing that cannabinoids can inhibit tumor growth. However, those studies are only done in rodents. The rodents also tend to get fairly high doses, which can be limiting, and no one has yet been able to translate that into human studies. It just simply hasn't been done yet. I think the data is promising in rodents, but I would never recommend using cannabis as, to replace chemotherapy or any other treatments that have been shown to be effective in a large clinical trial. That simply has not been done with cannabis and cancer.
So usually if there's a drug that's being tested on rodents that looks promising, there follows then a lot of research to determine whether or not that drug would be effective in humans. Why do you think that's not occurring here?
I think the main reason it's not occurring here is because cannabis is Schedule 1. That's why I started a little bit with about the history of this. I really feel, I understand, my research is an addiction. That's what I've done forever. I'm a psychiatrist, and there is a risk of addiction with cannabis use. This we know. However, what I would say, and that's part of the reason why cannabis is Schedule 1. However, as an addiction researcher, what I can say is that exposure to cannabis as a teenager, is problematic and worrisome. Exposure to cannabis later in life is less problematic and worrisome. The risk of an addiction when someone's taking cannabis and they're medically ill and they're middle aged is far lower than someone who's taking cannabis at the age of 15. And so I do think it's time to change our laws so that cannabis is no longer Schedule 1, so that it can be tested. The pharmaceutical company is probably less interested in cannabis. However, there are many cannabis companies that are. But I will tell you, researchers are very interested in this. We're very interested in looking at the potential for cannabis to serve as treatments for cancer and other indications. I don't think we can't believe everything that everybody purports, because right now cannabis is sort of the magic thing. It treats everything. That's not true. But it's also not true that there's no medicinal benefit to cannabis either. As in most things in life, it's complicated, but I do think we should be looking at these questions.
So Paula is asking, if someone has both epilepsy and psychosis, is cannabis appropriate? Is there any research that you might know about?
So the data with epilepsy is only in children with Dravet syndrome and Lennox-Gastaut syndrome. That's the only study that has been done so far on a large scale basis. There are reports of cannabis helping other types of seizures, but it really hasn't been studied significantly. When it comes to psychosis, the only studies that have been done are specifically in schizophrenia, and that's only with CBD. We do know that THC can worsen psychosis. So I would be wary of using any THC product in a patient who has psychosis. CBD, however, is not going to make psychosis worse. Now, the question is, will CBD make psychosis better? And the answer to that is we don't really know. We have some studies in schizophrenia suggesting that there might be a signal, but no one has looked at psychosis outside of schizophrenia. And I'll say that two out of three studies, 2 are positive and 1 was negative, so we still have a ways to go. So what I would, my answer to that would be like, we really don't know with cannabis, and in my mind, I would stick with traditional medications, especially in disorders as potentially severe, as problematic as seizures and psychosis. Neither of those are things that you want to be untreated for.
So you talked about your work with sort of pain reduction for neuropathy. What about other types of pain associated with cancer, like bone mets, for example?
So we don't really have data on that. We haven't looked at it. So when it comes to pain, there are some, let me back up. Actually, I'm not completely right. There are some studies from, I want to say maybe the 70s or 80s that did look at THC for cancer pain. Those were probably the first studies done. And that was specifically cancer pain, not neuropathy, but cancer pain. And those studies showed that THC was helpful and promising. They were small studies, but they were effective. And I will say, as before, I think I mentioned that of course, THC, I can't go back to my slide, can I? THC is thought to be about as effective as low-dose opioids. So 10 milligrams of THC is about equivalent to 60 milligrams of codeine. So I would say in a patient who has cancer pain from things like bone metastases, that is definitely an indication for opioids. Most patients in that category are going to be on opioids, either codeine or Percocet or something of higher potency. Nonetheless, many patients, especially medically ill patients who take opioids, find opioids aversive. They find that they have nausea or they have other side effects. And I would say if a patient has side effects from opioids and doesn't tolerate them well and has a lot of pain, as a physician, I would certainly try THC and see if it was less problematic for them and helpful.
And what kind of a doctor can prescribe medical marijuana?
So that's a very interesting question. Right now, in the government, in the United States of America, no physician can prescribe medical marijuana. That is completely against the law, and any physician who prescribes it can go to prison. However, when medical marijuana laws are passed, what that means is that the physician can authorize a patient as being eligible. So for example, in New York State, doctors who sign up for a medical marijuana program with New York State and they take a training course, any physician can authorize any patient as being eligible for medical marijuana or not. And what that means is they just sign a piece of paper saying that this patient meets the criteria for medical marijuana. In New York State, there are qualifying indications, which include they include cancer, they include ALS, they include Parkinson's disease, includes PTSD. But for our purposes today, it's mostly cancer patients with pain are definitely eligible for medical marijuana in New York State. In order to get it, you can look up physicians online. You usually have to pay them some amount of money and they will authorize you. And then you take that card, you get a medical marijuana card, and you go to a dispensary, and it's actually the dispensary that gives you the medication. So it's this funny way of getting around the law, the federal law, which prohibits the prescribing of medical marijuana.
And it's not covered by insurance, correct?
It is definitely not covered by insurance. I believe in New York State, I believe that the medical marijuana authorization visit may be covered by some insurances, but as far as I know, the product itself is not.
Okay, so some more questions are coming in. How is eating or drinking foods that contain marijuana different from smoking it?
So when you smoke marijuana, and I would just say, like, evolutionarily, I believe that we are creatures who are meant to ingest items in our gastrointestinal tracts and not through our lungs. Our lungs really don't have protections, and this is why people who smoke, whether it's cigarettes or e-cigarettes, you run the risk of lung cancer, you run the risk of EVALI, you run all these risks because the lungs really just aren't built to handle contaminants. The gastrointestinal system is. That's what it does. It weeds out all the gross things that we eat and it absorbs nutrients. When someone inhales cannabis, it gets into the brain faster, and so the high is a lot faster. When someone consumes cannabis orally, the effects are much slower. So for example, if you were to take cannabis orally, for example, I'll just use our study as an example. We give cannabis orally. Our product is THC and CBD together. We always give it at bedtime. We ask people to make sure they're in bed. And the main side effect that we see is that people are sedated and they sleep. If I had somebody inhale cannabis instead in our study, they'd probably feel pretty high and then maybe sleepy later. So because THC gets into the brain so much faster when you smoke, it has this different effect. However, I'll say one problem with oral cannabis is because it takes a long time to have an effect, people often take more because they think nothing's happening. And so in Colorado, when recreational cannabis was legalized, there were a number of people who ended up in the emergency room by eating cannabis gummy bears or THC gummy bears because they'd eat one, they don't feel anything, they eat another one, they don't feel anything, and before you know it, they've had too much, and now they're feeling horrible and miserable, and they're in the emergency room. So that's the main difference, though, is how fast the effect takes place, and also the type of effect. Smoking is much more likely to cause intoxication and high. Oral is more likely to cause sedation and sleepiness.
So throughout your talk, when you were talking about CBD, were you mainly referring to CBD oil that you ingest orally?
So CBD is usually sold as a variety of different products. As I mentioned, please don't vape CBD. I don't think it's safe. You can also buy capsules, you can buy gummies, you can buy chocolates, you can buy a lot of different things. If you're going to buy CBD from either online or a place, I generally would say try to get the tincture. It's probably the best for amount of medication for your money, and I would let it sort of absorb underneath the tongue. In our study, we use capsules, which means that there's a much slower release. And so, in my mind, I would lean towards something like capsules or tinctures, and definitely away from vape products. And then as for the rest of things like chocolates and gummy bears, I don't have a particular preference. I think they're similar sort of to other oral preparations.
And someone's asking a specific question about a topical THC slash CBD blend ratio of 5:1 obtained from a dispensary. What do you think it might be helpful for non-painful neuropathy?
Um, I don't know. I don't think that's answerable with the data that we have at this point. All of the research that looks at the effects of THC and CBD is in preparations that are ingested, either smoked or eaten orally. Certainly topically, some some chemicals or some products are absorbed, but I don't think we know anything about the absorption rate or the blood concentrations or anything else with topical preparations.
Okay, so in general, do you think people are sort of wasting their money when you go out and buy a CBD cream for
My personal opinion is yes, I think you're wasting your money. I think that there is some absorption through the skin, but I think it's pretty low. And so I think if you're given the expense of the product, I would probably take it orally. That said, if you use it and you find that it helps you, I can't argue with that. If.
Sure.
Mhm.
So can you talk a little bit about how cannabis might interact with anti-anxiety meds or antidepressants?
Absolutely. So the data that I showed when it came to drug-drug interactions, let me see if I can find that. Not sure where I put it. Anyway, oh rats. So the issue is this. There it is. Warfarin, Plavix, epileptics, antifungals, and some antibiotics. So we know, like when we as physicians, when we prescribe drugs, all medications, most of what we eat is metabolized by the liver. And the liver has certain enzymes that it uses to metabolize these different drugs, and that includes antidepressants and antipsychotics. So one of the issues is that you can have drug-drug interactions. You can have interactions between medications if you're taking different medications where they can either inhibit or increase the metabolism. When it comes to THC and CBD, we definitely think that you can have some drug-drug interactions. Now, this is mostly theoretical. This is based on research studies looking at liver enzymes. To my knowledge, I don't know of any case reports in the medical literature saying that a patient who took CBD and a patient who took antifungals had some sort of interaction. There is a report that there's an interaction between CBD and anti-epileptics. So we do know that it's possible, but we don't know how widespread it is. So it is possible that there's a drug-drug interaction between CBD and THC and other psychiatric medications. However, it probably doesn't kick in until high doses are being used, and it's not clear how much of an effect it has. I would just say if you're using these products, and if you, let's say, for example, you're taking um, Zoloft, and you start taking CBD, and you notice that you're starting to feel like jittery or hand sweats or all these other things from Zoloft, I would definitely be concerned and figure things out. But for the most part, unless you're taking high doses of medication, meaning high doses of CBD in the like 600 milligrams or above range, I wouldn't be too worried about it, but I would be mindful of it.
So someone is just asking a clarifying question. What do you mean by cannabis extracts?
So cannabis extracts are medications that are made by companies. Let's see if I have that somewhere. Um, Cannabis plant extracts. So when I'm talking about extracts, I'm really talking about the product that is in medical marijuana dispensaries. So this means that they've taken the plant, they know the concentration of THC and CBD, and they make products with it, which is either tinctures or the various other preparations that we just discussed. So that's what I mean when I'm talking about extracts. So it's not the plant itself, it's extracted from the plant and made into a tincture or a capsule or any other thing.
Mm-hmm. So you've answered this question in a number of ways, but it hasn't been put quite as bluntly as I'm going to ask it now.
Sure.
So someone is asking, is radiation and chemo necessary for cancer treatment? Does natural healing via a THC or CBD protocol, is that viable?
No, it's not. I would say please don't. It's putting your life at risk. It's putting your family at risk of being very upset. There's no data to support it outside of rodents, and keep in mind that the rodent data is rodent data is promising, but if until it's translated to humans, I would not. I mean, one of the advantages I will say of breast cancer is that we have very large, exceedingly well done clinical trials that come out in breast cancer regularly, almost every 2 years. And so we have looked at all of these different factors, all the different agents that are coming out now to treat breast cancer, the tried and true chemotherapies like adriamycin, Cytoxan. I mean, paclitaxel is a lifesaver. It has this horrible side effect, but it's efficacious. And I would say we have done huge amounts of research. Many women with breast cancer going back until the 70s have participated in these trials, and they've informed us. And we have to take advantage of that information and use it. What I'm talking about with THC and CBD here is really looking at painful neuropathy and seeing if we can help one of the side effects of being treated with standard medications, which we know work, and standard treatments, including radiation.
So someone is asking if the quality is basically the same in all the medical dispensaries across the country. And I guess together with that, so there's just clarifying, there's no regulations, federal
Right.
regulations on those dispensaries. And the way
Right.
around that is to ask for a COA so you could see what's actually in the product.
Right. So different medical marijuana dispensaries have different criteria according to different states. So for example, in New York State, the product is tested by an outside laboratory. Medical marijuana in New Jersey is actually not tested unless there's a problem. So there is a lot of variability, which is which is a little crazy across states into exactly how much testing they require. That said, I haven't heard of any problems with medical marijuana in New Jersey. So it's supposed to be tested, but unless there's a problem, it's not mandatory for the product to be tested in an independent laboratory. So there is a lot of variability. Nonetheless, I would still say that cannabis products from a medical marijuana dispensary from different states are probably, or I would say, or they're safe. I would say they're tested for the most part for THC and CBD and contaminants. When I'm talking about the COA, I'm really talking about purchasing CBD either online or in stores. That's when I would demand the COA, because when we're talking about CBD products, there's no regulation. So medical marijuana dispensaries, there is regulation. It does vary from state to state, but it's generally safe. CBD products are really unregulated, and that's when I would not bother to spend my money on a product that doesn't provide me with a COA so that I know what I'm buying.
So I just want to make one last call for questions. We have about 9 minutes left or so, and we'll just wait a moment to see if there are any other questions. Can you talk a little bit about, I mean, you're a physician. I'm assuming that you're not going to recommend that people buy unregulated cannabis or marijuana on the street. But people talk about, the cost of going to a dispensary, and that it's estimated to be about 30% higher than a street price.
Right. Absolutely. It is expensive, which I think is unfortunate.
Mm-hmm.
However, cannabis plant, which I called unauthorized sources or from the street or from friends, family, or dealers, you don't know what's in it. And we do know from case reports in the literature that sometimes it has salmonella in it, sometimes it has E. coli in it, sometimes it has heavy metals in it. There's really no way to know what's in the product. The concentration of marijuana bought on the street can vary significantly for THC. It can be very high, it can be very low. And if you're interested in CBD, if you're interested in the effects of CBD, cannabis that's bought on the street usually has no CBD in it. So I understand the problem. It's much cheaper, but you just have to know the risks. You have to be very careful. And certainly if somebody's in the middle of chemotherapy and immunocompromised, I would urge them to be exceedingly cautious with cannabis bought from the street.
Well, Dr. Martinez, you've provided a lot of really useful, helpful information. Thank you so much. Is there any parting words from you?
I would say my only parting words are that there is indications to suggest that there are medical benefits of THC and CBD. Those of us who do this research, we're trying to move things forward. There's a lot of people trying. We still have a ways to go, and just know that products aren't necessarily safe because they're being marketed as natural or something. You really need to look and see what's in there. Be careful. Don't waste your money on something useful, and don't buy something dangerous. That would be all I have to say.
That's good advice. And Jody's just adding in here that it's probably why it's more expensive, because it's grown under lab conditions perhaps and tested and analyzed.
Right. Yes. And the dispensary has to pay rent on their building and employees, and yes.
True.
But it is tested. There is an expense that comes with testing, and including testing the soil and testing the crops and testing the product.
Yeah.
And extracting it rather than just cutting off a plant and putting it in a bag. You have to actually extract the cannabinoids.
One more question. They're creeping in a little bit now. I have a CBD cream I use for peripheral foot neuropathy. The jar indicates it has 100 milligrams of CBD. How much of this should we rub on safely?
So again, we don't really know. I mean, I can tell you in our study, we're using 100 milligrams of CBD orally in a capsule. The studies in epilepsy used 1,000 milligrams. So we're really in the woods when we're talking about dose of CBD. We really don't know. Somewhere between 100 and 1,000 milligrams is what's treating most people. if the product that you bought was purchased sort of on the street, there's no way to know how much CBD is in there. If it's from a dispensary, it probably has CBD in it, but exactly how much is absorbed through the skin is really unclear. Nobody knows the answer to that question. No one has done a study where they've used a topical CBD and then tested blood levels to see how much CBD is absorbed through the skin and gets to where it needs to be.
Mm-hmm. And it's such a huge market, right? And everyone that uses it swears by it.
It's true, but
Yeah.
having done medical research for many years, we all know that there's also a tremendous placebo effect.
Mm-hmm.
Almost everything has a placebo effect, and I would not negate a placebo effect. I'm all about placebo effects. You can ask my 2 children. When they were little, I always gave them placebo for things. But that aside, the downside of placebo effects is that they don't last. It tends to
Right.
be very short-lived. And so if you're testing, a medication for depression versus placebo, everybody improves right away, but people who got placebo worsen after a short period of time. And so
Mm-hmm.
I have nothing against placebo effect, but what I'm saying is don't spend your money on it. And certainly don't spend money on a placebo that could have some contaminants.
So, Dr. Martinez, I think we're at just about at the end here. So thank you so much. This was really important evidence-based information that was important for our patients to hear. Thank you so much. You really clarified so many things for us. Really
Absolutely.
appreciate it.
Happy
So
to do it.
thank you everyone for participating. If you wouldn't mind filling out the evaluation form at the end of the webinar, that helps us to inform future presentations. Dr. Martinez, thank you so much again. You are great. Thank you so much for helping us out today.
Absolutely. Thank you for having me.
Thanks, everyone.